Okay, Matthew Holt. I'm now back in one of the really glamorous rooms, but this is Eileen Rivera from HIMSS Corporation. She is the one who paid for these exceptional chairs, which probably cost, I don't know, $25,000 to rent for 2 days from the low price folks here in the HIMSS session. Anyway, so we're not discussing where HIMSS's marketing budget is going. We just found out. All right. So Eileen, HIMSS Corporation. Most people, if they've heard of you, would think you're a really big defense contractor. What are you doing in a healthcare show? So HIMSS actually has got a big healthcare operation. Bought a couple of big healthcare companies.
That's a great question. I'm really glad you asked that question, because that's how most people know HIMSS, as a premier defense contractor. In fact, they just got bigger with the announcement last month of Axcelis Corporation. So now they're going to be one of the top 10 defense contractors. But that is not where we in the healthcare business necessarily are playing, if you will. We're trying to solve some interoperability challenges that HIMSS already solves in places like aviation. So the way we kind of talk about why HIMSS is in healthcare is because they've addressed some interoperability issues in a completely different sector, completely different market, and we're applying some of those kind of lessons learned, and how can we use some of those best practices, if you will, in the healthcare business. And so at the HIMSS Healthcare Solutions, we are focused on the major challenge that a lot of folks here at HIMSS are trying to solve, which is the whole issue of how do we clinically integrate patient records across multiple health systems. And so we're really excited to talk about some of the things that we're doing at places like right here in Chicago, Advocate Healthcare, one of the largest health systems in Illinois, and I know here in Chicago.
Actually in the country too, yeah.
In the country, exactly.
I think it's the biggest official ACO, isn't it? I think so, yeah. Anyway,
is it? Well, thank you very much. I appreciate all of that great historical, great factual data. So we just announced this week that we've helped Advocate launch its mobile patient portal. So you can get out your little phone here and you can download the app from Advocate. So if you're a patient with Advocate Healthcare, you can then download your patient portal and you can enter information on your phone. So, our whole world is mobile now, right? Everything has to be available, it has to be easy. And the only way you're really gonna get a patient engaged in their health, you gotta make it easy. And going home at night and having to sit down in front of your desktop, a lot of people still do that, and people still will always do that. But what we've just helped Advocate do is to create a mobile patient portal so that you can download it, you can schedule appointments with your clinician, you can view any lab results that you may have had, you can re-up prescriptions, you can pay your bill. And those are just some of the things that I find personally time-consuming, just when I'm dealing with my own clinician. So we've helped with that with Advocate. So some other exciting things we're doing that we're talking about here at HIMSS is that we just published a white paper, the 5 inconvenient truths about clinical systems integration and 5 strategies for moving forward anyway. And I think it's a quick read. We had several clinicians, several doctors talk about, why is this so hard? Why is clinical integration something that we're still talking about? Why is interoperability still like the major buzzword at HIMSS, but not just in HIMSS, but in the whole healthcare space? And it's because we still haven't gotten to the heart of the problem, which is that the way many health systems now have invested their resources is in these large-scale EMR systems. And every health system's got their choice. They can pick what flavor they want of EMR systems. Many health systems have multiple. I'm always so shocked how many health systems have more than like 6 or 10 EHRs or EMRs. We're not competing. HIMSS Healthcare is not competing with those health systems, those EMRs. We have built a platform that we call Fusion FX, and that's what I was just describing with Advocate. They are engaging us in creating this platform for their clinicians and for their patients, so that their clinicians have a whole health view, a longitudinal view over multiple EHRs. So let's just say, I'm a patient at Advocate and I go to one facility for, let's just say, one specialist. Then I go to another Advocate facility for another specialist. All of that data will be then viewed under one longitudinal platform that we have helped Advocate do. Advocate's one of many customers that we work with in the country, around the world, in the UK, in Canada, and also in the Middle East. So we're really excited about the growth that we're seeing. You know, clinicians need what we have, and so we're having a good time talking about it here at HIMSS.
Okay, cool. So that's a great general overview. Let's do some rapid fire stuff. How big is Harris's healthcare business in terms of revenue and people?
Roughly, we're about 35 million. We've got about 200 folks that support the business all over the country, all over the world.
You mentioned bringing stuff from defense. You also bought CareFX, which was a sort of data integration company a couple of 4 or 5 years back.
4 years ago, right.
A while back. How much of what you're doing comes from that? How much has been brought in from other parts of the business? How much is some new stuff you've been
That's a great question. So when Harris acquired CareFX, it acquired, of course, you know, the technology and the customer base, but Harris has invested quite a bit in, I would say, refining the technology to a point that it doesn't have to be customized in every installation and every implementation. So I would say that the strength of Harris is its engineering heritage, its engineering base, and you know, Harris now, I think I don't know exactly how many engineers there are going to do with the Excelis acquisition, but you know, we have engineers out the wazoo. Right. I hope I can say that. But they're everywhere.
You just did, and the tape is running, so it's fine.
I'm definitely outnumbered. You know, as a marketing and communications leader, I am definitely outnumbered by those engineering folks. But I appreciate what they do because they've really, you know, helped refine and I would say make the product more valuable. So I would say that last HIMSS we unrolled Fusion FX, and that is our care collaboration suite that not only includes the patient portal that I was just describing, that Advocate is our like marquee customer. It also has a provider portal. It also has a referral management tool, as well as a secure messaging capacity. So this year we are talking a lot about Fusion IQ, which is our business intelligence tool that we've refined over the last 5 years with the Cleveland Clinic. And also our newest technology, our newest tool, it's called Fusion OS, Fusion Operating System. It's like, you know, think about the Apple OS. We kind of borrowed that, if you will, to brand our third product set, which is really to create this middleware that I know people talk about. What is middleware? You know, the way I like to describe it, because I'm a very visual person, I'm going to say this, it sits on top of the EHR or EMR. And it's the common system so that no matter if you're a health system in Iowa, a health system in Washington State, a health system in Ireland, it could all be connected. Just think about, you know, when I go overseas and I need money, I go to the ATM, I get money out. My ATM card can be read by anywhere in the world, right? Wouldn't it be nice if you go overseas and you're traveling and your personal health record could be viewed anywhere, so that you don't have to worry if you get into an accident, when you're on vacation, you're on a business trip, that your health information can be automatically sent to wherever you're having care. That's where we're heading with Fusion OS.
Okay, very cool. So you've got a whole slice of products. If you think about it, you're in a business where you're split between your government work with the VA and elsewhere, and then you have private sector clients. You're also in a business where there are lots of other people doing each of the different pieces that you're talking about, and not only established companies but a lot of startups who are sort of challenging away about that. Why do you think that, how do you, when someone wants to work with you, there's the selling point, which is you're a big company, but there's also the issue that you're a big company, right? So how do you sort of, how are you trying to project in the market what you guys are really good at, and why to work with Harris, not with somebody else?
So what we do that no one else can is we provide one-touch access to whole health information. And what I mean by that is, you know, there's a gazillion devices that a clinician today has to touch. And patients also have to touch. We've developed the technology that in one touch, you can see your whole health profile. So that's what we do differently. No one else here on the HIMSS floor can make that claim. There are companies that I would say that think they can or are trying to, but we've already gotten there.
Okay, we're going to leave on that moment of triumph. We're talking with Eileen Rivera. She's the Vice President of Marketing at Harris Corporation, which is, for those of you who should know by the end of this interview, is doing a lot of healthcare, a lot of exciting stuff, and we look forward to seeing how that develops.
Thank you, Matt.